lot of people, there comes a time when hair gets a little bit thinner, a little bit grayer, and there just seems to be less of it. And maybe a hair transplant wasn't what you were hoping to have, but now hair transplants have an extra cool factor because surgery just got robofied. You heard me correctly. Today, for the first time ever in Canada, a robot and surgeon buddied up on a hair transplant. And Dr. Rahal is fresh out of the operating room, and he joins me now. So can you just tell me what happens in a hair transplant procedure?
Well, typically in a hair transplant procedure, we want to remove hair from the back, what we call a donor area. The donor area is genetically programmed not to be lost in the future. So we want to take those hairs and we want to put them in the front or the top or even the crown, depending on the individual patient. So we want to take them out. These hairs have to obviously survive, and the method of taking them out and the procedure ensures their survival. And this is where the technology is advancing.
So in the past, you've done this by hand, and now what exactly is the robot doing in this procedure?
The robot, what it does is it has two cameras right in the front. It's basically mapping out the grid. The grid has all the hairs that it wants to remove. It will precisely, to a very, very small factor, calculate the angle of where these hairs exit from the back of the skin or the head. And calculates their direction. So when the punch moves in to the skin to be able to extract those grafts, it's going at the precise angle that those hairs are coming out. And the reason that is so important is it's a very small punch. It's between 0.9 millimeters to 1 millimeter punch. You want it to go right over the hair and the root in a cylinder. So if you're off by a very small degree, you can actually damage the follicle, and which is something we don't want to happen.
That makes a lot of sense. So are robots better at doing this than a human? Are they faster? Are they slower?
It's a little bit more faster, a little bit more precise than a human. And that's where the advantage of the robot makes this procedure more, I guess, more available to many patients, because you can do a lot more grafts in one setting or one session.
Is this thing flying solo, or is there somebody overseeing the procedure while the robot does its work?
There's usually 3 people operating it, so it's not something that you set it and leave it and go for coffee and come back. So it is something that we have to basically assist it, so we have to guide it to where it goes. We are always monitoring and looking over the grafts that are being removed to make sure that everything's on track. So it's not in a typical surgery. You need 7, 10, even 12 people. In this case, you're narrowing it down to 3 well-trained individuals, and that's going to create more efficiency and, I guess, less manpower.
When you're doing procedures with a robot, you obviously have to think about worst-case scenarios. What is the worst thing that could go wrong with a robot pulling hairs out of the back of somebody's head?
Not really much, because we are controlling the speed of the extraction. We can control the depth of the extraction. We can control the speed of it and the angle. So essentially, it is automated. At the same time, we are still overriding it. As far as risks, anything, in terms of any procedure, the patient has to be healthy. The patient is monitored. We want to look at their other, factors that they're good candidates for the surgery in the first place. But as far as the robot per se versus a technically manual one, there is no extra risk.
So the robot helps get the hair out from the back of the head, but does the robot play a role in putting the hair back in on the top or on the front of the head?
At this point, no. At this point, we still have to do that particular part of the procedure manually. So we need to create the incisions manually. We need to plant those grafts in manually. According to the research, there will be the next phase where the robot will actually make the incisions. And I don't think it's going to ever do the implanting, but that is a possibility. So the next part of this is it's going to make the incisions, and then potentially thirdly to put the implanting in.
Do you ever foresee a day when the robots are going to be able to do the whole thing from start to finish?
If possible, it's going to be about at least 10 years away. I don't think you're always going to need a human hand, human touch. With the hair transplant surgery, there's a lot of art to it. There's science, of course, but there's a lot of art to it. You know, designing a hairline, designing a hairline appropriate for the patient, make sure the patient's qualified. All these things are human, you know, factors. When it comes to the actual technical part of it, certainly the robot and any other advances will play a bigger role.
So that human touch is still there for now?
Yes, no, I mean, it'll always be there, I feel. The human touch is always going to be there to guide it along.
Well, congratulations on pushing the technology forward. Thanks for talking to us, Dr. Rahal.
Thank you. Thank you very much.